Today we are going to discuss about the blood supply to the eyeball. In previous lectures I have covered the detailed structure of the eyeball. So in this lecture I am going to cover a blood supply to the eyeball. So myself Dr. MURALEEDHAR Badigere, Department of Sharirachana, Gramin Ayurvedic Medical College, Terdal. So before going to start the discussion on the blood supply to the eyeball, first major blood vessels I am going to discuss. In the neck region, on the right side and left side, the two major blood vessels are there. They are called by the name of carotid arteries. So right carotid artery and the left carotid artery. Left carotid artery is the direct branch from the arch of the aorta, and right carotid artery is the branch from the brachiocephalic trunk. These two carotid arteries are ascending upwards in the neck region, and in the neck region they are divided into two branches. One is the right common carotid, there is a external carotid artery and the internal carotid artery. So common carotid artery further divided into external carotid artery and the internal carotid artery. Ignore this external carotid artery, concentrate on the internal carotid artery. This internal carotid artery, at the base of the skull, it pierces and entering into the cranial cavity. So now when it's entered into the cranial cavity, it involved in the formation of the circle of Willis. Circle of Willis is helpful for the blood supply to the brain. Ignore that part, concentrate. This carotid artery, this internal carotid artery gives one major artery that is supplying to the eyeball. So that branch is called by the name of ophthalmic artery. So this ophthalmic artery is supplying the blood to the eyeball. So this is a major artery which is supplying to the blood to the eyeball. So it means internal carotid artery, which is the branch from the common carotid artery. When intracranial part of the internal carotid artery gives the branch that is known as ophthalmic artery. So this ophthalmic artery, when it reaches to the eyeball, it is divided into major branches. So that is called anterior ciliary arteries and the posterior ciliary arteries. Ophthalmic artery gives the branches, ciliary artery. Ciliary arteries are further divided into two groups, anterior and posterior. Posterior ciliary arteries are two sets. Some of the posterior arteries are long, they are called posterior long ciliary arteries. Some of the arteries are short, they are called short posterior ciliary artery. And apart from that, we will get one more branch that is called retina. It means first layer is vascular, then there is no question of the blood supply, and second layer is supplied by the ciliary arteries, and third layer is supplied by the central artery of the retina. See, in this picture we can visualize this is the common carotid, this is the ophthalmic artery. See, this is ophthalmic artery. Ophthalmic artery gives the branches. So this is a long ciliary artery, or you can say posterior ciliary arteries, these branches. So this posterior ciliary arteries is a long one, then it is called long posterior ciliary artery. If they are short, then called by the name of short ciliary arteries. So then along with that, from this ophthalmic artery, this is ophthalmic artery, this is the ophthalmic artery, these are the long posterior ciliary artery and short posterior ciliary artery. See, here there will be one artery which is running here, it is called central artery of the retina, which is supplying to the third layer. So detail we are going to discuss. See, in this picture, first layer is avascular, ignore that. Second layer we will discuss the blood supply. See, ophthalmic artery. From the ophthalmic artery, see, short arteries are there. See, small arteries are arising and supplying to this area. So these are called by the name of short posterior ciliary arteries. And some of the arteries are there. They are entering here up to the, they will cover up to the iris. So in this picture you can see this is going to the up to the iris. So this artery is called by the name of long posterior ciliary artery or posterior long ciliary arteries. This posterior long ciliary artery is coming up to the iris. In the iris, outer border of the iris, it make one circle that is called major arterial circle, and around the central margin of the iris, it will make another arch here or another circle here, that's called minor arterial circle. So this is the minor arterial circle and the major arterial circle. It means the second layer is mainly supplied by the long posterior ciliary artery and the short posterior ciliary artery. And third layer is supplied by the blood vessel that is called by the name of central artery of the retina. See, in this picture, this is central artery of the retina. The artery is entering here, dividing and supplying to the retina. So in this picture you can see very clearly this is central artery of the retina which is supplying the blood to the retina. So this is the major retina or nervous coat is supplied by central artery of the retina, and also outer layers are supplied by the choroid, that is vascular, through the diffusion mechanism. You should remember second layer is supplied by ciliary arteries and third layer is supplied by central artery of the retina. Next we are going to discuss about the venous drainage. Already we know the venous drainage of the eyeball. Eyeball is having the internal vein along with the arterial supply. The similarly veins are there. For example, posterior ciliary veins arteries are there, then posterior ciliary veins, anterior ciliary arteries, anterior ciliary veins, like that all the veins are there. Ultimately all the veins are going to arise from the sclera or exiting through the sclera here in the form of vena verticosa. And these vena verticosas are superiorly to inferiorly to, you can consider, and all these vena verticosas are merged and going to form the major blood vessels superiorly, that is called superior ophthalmic vein. Similarly, there is another vein is going to form here. This is called inferior ophthalmic vein. So the superior and inferior ophthalmic veins are finally posteriorly they are draining to the cavernous sinuses and anteriorly they are draining to the facial vein. It means venous system of the eyeball has ultimately has a two veins, so superior ophthalmic vein and inferior ophthalmic vein. Both side they are draining. Internally they are draining to the cavernous sinuses and externally or means anteriorly they are draining to the facial veins. So in this picture it's very clear. See, superior ophthalmic vein, inferior ophthalmic vein, they are draining to the cavernous sinuses or anteriorly they are draining to the facial vein. So the facial vein or this whatever it may be, the facial vein or it may be carotid sinuses, ultimately they are draining to the jugular veins. That's the internal jugular vein or the external jugular vein. They are present in the neck region and finally their blood is reaching to the heart. So we are going to discuss next point, the nerve supply to the eyeball. So nerve supply is mainly ophthalmic nerve. Ophthalmic nerve is the branch from the trigeminal nerve. See, this is a trigeminal nerve, is the cranial nerve. It has three branches, trigeminal. One branch is the ophthalmic branch. So this ophthalmic branch mainly it is supplying to the eyeball. And next optic nerve. Optic nerve is the major cranial nerve or one of the cranial nerve which is entering inside the eyeball, and mainly this optic nerve is mainly involved in the perception of the vision. It is a purely sensory to the eyeball. Next we are going to discuss about the optic errors or the refractive errors. Refractive errors are two types. One is the normal. See, light rays are entering through the lens and accommodating here, then accommodation is taken place in the fovea centralis. This is a normal. So in some conditions what is going to happen, light rays are concentrating or converging behind the retina, then it is called hypermetropia. This hypermetropia can be corrected by giving the convex lens. So when a convex lens is given, then conversion of the light rays inside the retina or fovea centralis. In sometimes the conversion of the light rays takes place in front of the retina, not on the retina, in front of the retina. So in condition also vision is not going to form. In such a condition we are giving the biconcave lens, and by giving the biconcave lens then you can converge the light rays into the proper area. So this is called by the name of myopia and the hypermetropia. So light rays are converged in the posterior to the retina, then it is called hypermetropia. That is corrected by the biconvex lens. Myopia means conversion of the light rays in front of the retina, not on the retina, in front of the retina. That is called myopia. Myopia can be corrected by giving the biconcave lens. So next we are going to discuss the another chapter here, a little bit related to the eyeball, because eye is moving inside the orbital cavity superiorly, inferiorly, medially, laterally, and superior-medially, superior-laterally. So by the help of all these movements of the eyeball is the depends upon the extraocular muscles. Oculi means here the eyeball, the muscles attached to the external part of the eyeball, so that helps for the movement of the eyeball. They are called by the name of extraocular muscles. These extraocular muscles are, first one is a medial rectus, or you can say four recti muscles. Recti muscles 4, see, is looking like a plus mark. See, these are the recti muscles. So this is the recti muscle. So these recti muscles are, see, one is a superior rectus, inferior rectus, medial rectus, and the lateral rectus. So these are the four recti group. And next is one more is a superior but oblique, another one is inferior and oblique. So that is called superior oblique. See the picture, in this picture this muscle is superiorly oblique, that's superior oblique. inferior oblique. So totally 6 muscles. Then there is another muscle, levator palpebrae superioris. So the muscle which helps for the elevation of the upper eyelid. So that is called by the name of levator palpebrae superioris. But we can consider this levator palpebrae superioris as a facial muscle also. But you can include in eyeball also, you can include in the facial muscles also. So one by one we are going to discuss. So before going to discussing the muscles, first we should know the movement of the eye. See in this picture. In this picture you can see the first one is the primary position. So it is a normal position of the eye. A person is seeing towards the anterior aspect. So then the person is moving the eye towards the medial side, towards the nasal side. Then that's called by the name of adduction. That's called adduction. If the person is moving eyeball on the lateral side, then it is called abduction. Next, there is elevation. So if the eyeball is lifted up, then it is called elevation. If the eyeball is moved downwards, then it is called depression. Then another two more words are there, very important: extorsion and intrusion. Extorsion means movement of the eyeball superior laterally. That's called extorsion. And intrusion means the movement of the eyeball superior medially. So that is called intrusion. See in this picture, the movement of the eyeball towards the nasal side, it's called adduction. Movement of the eyeball towards the lateral side, this is called abduction. Movement of the eyeball upwards, that's called elevation. Movement of the eyeball downwards, that's called depression. The movement of the eyeball superior laterally, that's called extorsion. And movement of the eyeball superior medially, that's called by the name of intrusion. So these are the movements. Then it's easy to understand. Then what is the medial rectus? Medial rectus helps for the adduction. Lateral rectus helps for the abduction. Superior rectus helps for the elevation plus adduction and intrusion. And inferior rectus helps for depression plus adduction and extorsion. Superior oblique helps for the depression, adduction and abduction and intorsion. And inferior oblique helps for the extorsion, elevation and abduction. Levator palpebrae superioris helps for the elevation of the upper eyelid. So in general, see, medial rectus, movement of the eyeball towards the medial side. Lateral rectus, movement of the eyeball towards the lateral side. Superior rectus, movement of the eyeball superiorly. And also intorsion. Intorsion means the movement of the eyeball superior medially. And inferior rectus helps for the movement of the eyeball downwards, but extorsion, that is superior laterally. Superior oblique helps for the depression, and inferior oblique helps for the elevation and the extorsion. And these are the movement of the eyeball related to this one. So come to the point, nerve supply to this these muscles. The formula is there, it's easy to remember. There is LR6, SO4 and remaining all are supplied by the third cranial nerve. LR6 means lateral rectus is supplied by 6th cranial nerve, and superior oblique is supplied by 4th cranial nerve, and all remaining muscles are supplied by the third cranial nerves. So see in this chart, medial rectus 3rd cranial and lateral rectus 6th cranial nerve, superior rectus, inferior oblique, all are supplied by the 3rd cranial nerve. But superior oblique supplied by 4th cranial nerve, SO4, and LR6 means lateral rectus supplied by the 6th cranial nerve. So this is about the cranial nerve supplying to the muscles. So in this session I am going to complete all the eyeball. So thank you for watching.